Good morning, everyone. Welcome. I'm going to let those who are still arriving take their seats. Good morning. Good morning, all. Oh, you're a very obedient crowd. Silence has fallen without me even having to ask for it. Good morning, all. Guten Morgen, because we are, after all, in Germany. Good morning, Excellencies, distinguished speakers, esteemed participants. Welcome to all of you who are also following online. Welcome to the keynote session of the 2024 World Health Summit entitled Investing in Women's Health, Driving Global Development. There is more to the name, but I'll let you read it. I am Eliza Anyangwe, the managing editor of As Equals, CNN's reporting project that focuses on the causes and solutions to systemic gender inequality, and I am delighted to be your moderator of this session. 2024 marks the 30th anniversary of the Cairo International Conference on Population and Development, the ICPD. You'll hear more about that, where 179 nations together decided to prioritize reproductive rights, women's empowerment, and the reduction of inequalities. Against the backdrop of falling ODA, of multilateral support, growing polarization, what was achieved in Cairo 30 years ago is even more remarkable to contemplate today. But as we celebrate the progress of 30 years ago, we also recognize the significant challenges that remain, with health inequity gaps still vast. Today's session aims to underscore the pivotal role of women's health in the global development agenda and introduce key initiatives that are set to accelerate the progress for women and girls in developing countries. Together here, over the next 90 minutes, we will explore commitments and partnerships that advance women's health, reduce inequities, and accelerate innovation. And we are honored to have distinguished speakers leading that effort. So thank you all for joining us. I will invite you to clap many times, so let's have a practice now. Wonderful. Thank you. All right, but before I call them up, please watch this short video with me.
The ICPD community is committed to delivering a world where every pregnancy is intended, every childbirth is safe, and every young person's potential is fulfilled. 3 decades ago, at the International Conference on Population and Development, 179 nations pledged to prioritize sexual and reproductive health and rights and reduce inequalities. Today, despite significant progress, inequities persist, and investments in women's health remain insufficient. Women's health is at the heart of sustainable development. Centering women empowers communities, it drives economies, and nurtures future generations. Now is the time to close gaps and build a world where every woman and girl thrives. As we mark 30 years of action, let's reaffirm our commitment to making women's health the cornerstone of global development for a brighter, more equitable future.
Okay, our session can now officially begin. Welcome again to the 2024 World Health Summit. You will now hear 4 opening keynotes and remarks from speakers distinguished by their leadership, experience, and commitment to advancing women's health. Please join me in inviting to the stage Her Excellency Svenja Schulze, Minister of the German Federal Ministry of Economic Cooperation and Development, and one of our co-chairs. Welcome up, Dr. Schulze. Dr. Natalia Kanem, Executive Director at the United Nations Population Fund, our other co-chair. Thank you. It's a bit like a fashion parade. Each person one at a time coming up. Fantastic. Do not be intimidated by the stairs. Dr. Tedros Ghebreyesus, who is the Director General of the WHO, the World Health Organization. And finally, Ms. Glory Charles, a youth activist and innovator from Tanzania. Please welcome Glory. Now for our keynote speakers. Please do take the lectern each in turn. I will introduce you all, but it's just over there. Minister Schulze, let us begin with you. Welcome.
Ladies and gentlemen, distinguished colleagues, you just see that in the film before. Every girl has the right to choose her own path, and every woman has the right to decide for herself whether and who she will marry and when she wants to have children. That was the promise of the International Conference on Population and Development in Cairo in 1994. And since this conference, many things have become better. Fewer women and babies die in childbirth, more people have access to health, and even if there are still so many girls who become pregnant before they are 18, the numbers has decreased a lot over the last 30 years. Still, there are many people for whom the promise of Cairo has not yet materialized, and that is why today's event is so important. A warm welcome to you all, also on behalf of the United Nations Population Fund. As long-standing partners, the German Development Ministry and UNFPA have been working worldwide to strengthen the health and rights of women. Women like Mandeva from Togo, so that she will enjoy equal participation. Mandeva had an unplanned pregnancy when she was 17. She had had no sexual education. She knew nothing about family planning. And when she got pregnant, she did not get sufficient maternity care. She lost her child just 1 week after birth, a traumatic experience. In order to spare other women a similar fate, Mandeva decided to get trained as a reproductive health mentor through an initiative supported by Germany. And now she shares her experience with women of her age and educates them. In this way, she also contributes to social change so that it will become an accepted understanding that women can make their own choice about their lives and their bodies. That women need access to health and modern family planning, which empowers them and benefits society as a whole. And this is precisely what my feminist development policy is about. And this also means putting a focus on diseases that have been neglected, but that often have severe social and health impact, especially for women and girls. Neglected tropical diseases, for instance. They affect women far more than men because women are more likely to be poor and because they are much more exposed to infectious agents, for instance, when they fetch water and when they look after their children. FGS is one such neglected disease. For such diseases, more money needs to be invested in research and treatment so that all people will enjoy equal participation in society. Much remains to be done to ensure the equal participation of women, girls, and marginalized groups. And ultimately, when all people enjoy equal participation, all of society benefits. Thank you.
Thank you, Your Excellency. Some of those words that we just heard are themes that are going to be recurring, I'm sure, throughout this session. So let me invite up our next speaker, Dr. Kanem, to address us.
Excellencies, Minister Schulze, esteemed Dr. Tedros, my dear brother, Dada Gloria, distinguished public health leaders, colleagues, dear young people, welcome. My greetings are of peace. Peace is the noble purpose of the United Nations, and it is the fervent wish of UNFPA for women and girls the world over. I'd like to thank you also for joining us for this worthy and timely discussion of championing a woman-centric future. And this year, as we commemorate the 30th anniversary of ICPD, the International Conference on Population and Development, there is indeed much to celebrate. That groundbreaking ICPD program of action signaled that at long last, women are to be placed at the center of development. Reproductive health was named a big concern to be prioritized. Women's right to bodily autonomy and gender equality were recognized as essential for individual well-being and for sustainable development. And the adolescent girl took her place. Health, education for the adolescent girl became visible in programming. And in the ensuing 3 decades since 1994, undeniable progress. The number of women using modern contraception doubled. Unintended pregnancy dropped by nearly 20%. Fewer girls became mothers during their own childhood, and since the year 2000, maternal deaths fell by nearly a third. Unfortunately, the pace of that progress is now slowing. By many measures, it has stalled completely and even retrogressed. Today, far better data systems allow us to more clearly discern the unacceptable rates at which women continue to die while giving life. Every 2 minutes, a woman dies from complications of pregnancy and childbirth. Why? And remember, the woman who dies in childbirth often is not a woman at all. She's a mere girl, married too early, pregnant too early. She didn't stand a chance. And every 2 minutes, another woman succumbs to cervical cancer, 2 more to breast cancer. Again, we ask, why? Reproductive health failures remain the leading cause of death and disability among women and girls in low and middle income countries, most fully preventable. So then why isn't more being done? One important reason, as UNFPA's State of World Population Report shows, is we don't sufficiently prioritize reaching people furthest behind first. For instance, a woman in a fragile health system is 130 times likelier to die from pregnancy complications than a woman with access to emergency obstetric care. Women of African descent and indigenous women have up to a 6-fold risk of maternal mortality compared to the reference population. Discrimination and disrespect lead to inadequate care and treatment, hence heightened mortality. Inequality skews health outcomes. It's a picture that must change from primary care on upward, from before the moment of birth, starting with prenatal care, right through the life cycle, into menopause, and hopefully a ripe old age of healthy longevity. So to change the picture, what's the catalyst? There is a clear answer. Invest in women's health to drive global development. For better individual health and well-being, yes. For happier, healthier families, and for more stable, sustainable economies and communities. And we must start by redoubling investments for comprehensive universal health care, grounded in both human rights and science, because $1 invested in reproductive health returns up to 120 through helping girls finish school and by boosting women's workplace participation, thereby adding trillions to the global economy. And the businesses that support gender equality and employee health are proven to thrive. Higher productivity, lower turnover and absenteeism, and more company loyalty. Midwives, always the heroes of the story, could provide most sexual and reproductive health services, yet midwives remain undervalued and far too few. With our partners, UNFPA will close the midwifery gap by training nearly 1 million more midwives, so every woman can access life-saving care she deserves. How we invest how we invest also matters. Gender equitable solutions truly do make a difference, and that means expanding funding for women-centric research and development. Now, only 1% of global health research funding addresses women-specific conditions apart from cancer. And worse yet, in developing countries, it's just 0.2% of research funding. For the biggest impact, scale up investment in maternal health and correct the massive disparity in developing new treatments. Take postpartum hemorrhage. Such bleeding contributes hugely to maternal death, and it's entirely preventable. Yet, in 3 decades since Cairo ICPD, only 2 new medicines address it. Excellencies, dear colleagues, certainly we can and must do better. Working together, we can shift the status quo. And in a world grappling with distrust, polarization, and science deniers, and an avalanche of misinformation and disinformation, this year's summit theme, Building Trust for a Healthier World, is apt. It's relevant. It's needed. Trust is the foundation upon which we build resilient health systems, peaceful societies, and an equitable, sustainable common future. And that trust will be earned through our actions. Today, billions still lack access to basic nutrition, health care, hygiene, leaving them vulnerable and exposed without a safety net. 1 in 3 women in her lifetime will be subjected to sexual and gender-based violence, harassment, or abuse, left to pick up the pieces and deal with the indelible consequences of that assault on her dignity. The COVID pandemic exposed the cracks and the chasms, really, in health systems, underscoring that equitable health care is not a luxury. It's an urgent necessity and a fundamental human right. The SDGs, the Sustainable Development Goals, guide us towards that world we want, where everyone has access to care they need. And it was Dr. Nafis Sadik of UNFPA, presiding over the Cairo ICPD, who stated, "The first mark of respect for women is support for their reproductive rights. Women are strong and powerful, and they carry half the weight of the world. Therefore, champion sexual and reproductive health and rights as cornerstones of an equitable healthcare system." So to close, at UNFPA, we've looked at the evidence, we've studied the numbers, and understand that those numbers represent real people in real communities with real needs. And we further understand that the greatest potential solutions will be women-centered solutions. And that's why at this World Health Summit, UNFPA is so excited to launch Women X, a collective designed to close women's health gaps through advanced solutions that are scalable, sustainable, and tailored to developing country contexts. Partnering with CIF, the Children's Investment Fund Foundation, Organon, and the government of Germany. Tomorrow, UNFPA proudly inaugurates the very first Women X Collective hub right here in Berlin at Charité, a global leader in medical research. Leveraging UNFPA's global presence and partnerships and expertise, the Women X Collective will identify, deploy, and scale up the most promising solutions of greatest impact. And our goal is simple: deliver better health outcomes for women and girls. Do it through policy engagement, sustainable financing, and always strategic partnerships and collaboration. That's why I ask you to help UNFPA and the United Nations to build and bolster the trust. Together, through action, innovation, and commitment, we will finally achieve a more peaceful, equitable, healthy, and prosperous world for women and indeed for everyone. Thank you.
Thank you so much, Dr. Cannon, for those words that have set the stage, talking about peace and talking about equity for women being equity for us all. So thank you for setting the stage. I invite up to speak next Dr. Tedros.
Thank you. Thank you, Eliza. You reminded me of my time when I was a technician. I studied immunology, and ELISA was one thing I was doing every now and then. That's immunolinked immunosorbent assay, until I got tired of it. So when she told me her name, ELISA, I said, oh, I'm not going back there. My panelists, Minister Schultz, Natalia, Gloria, dear colleagues and friends, today we gather not just to commemorate 30 years of the International Conference on Population and Development, but to ignite a movement that recognizes the essential role of women's health in global development. Investing in women's health is not merely a moral imperative. It's a strategic necessity for achieving sustainable development and fostering equity across the globe. Investing in women's health is not just about addressing health disparities. It's about unlocking a powerful catalyst for development. It means investing in women is about the development of all of us. It's about when we prioritize the health of women, we create a ripple effect that benefits families, communities, and entire nations. Women's health is shaped, as you know, by many biological and social factors. Gender inequalities, socioeconomic disparities, and access to health services all significantly influence women's health. In regions like sub-Saharan Africa, my own continent, we see stark disparities. Maternal mortality and morbidity, along with HIV, remain leading cause of death for women aged 15 and 49. These statistics are not just numbers. They represent lives lost and futures unrealized. Despite women living longer than men on average, the quality of life for many is marred by injustice and inequities. Women face disproportionate health challenges exacerbated by discrimination against marginalized communities, including women with disabilities, indigenous women, and those living with HIV. 1 in 3 women experience intimate partner violence or sexual violence in their lifetime. Nearly half of all pregnancies worldwide are unintended. Women earn on average half of what men earn and are disproportionately involved in unpaid care work. Yet, the most transformative contributor to women's participation in the workforce over the last 3 decades has been access to contraception. The COVID-19 pandemic has exacerbated these challenges. Historically, women's health has been perceived through a narrow lens primarily focused on reproductive capabilities. However, we must adopt a comprehensive approach that considers the full spectrum of women's health needs and priorities. We also recognize the significant knowledge gaps that persist in the field of women's health. Many clinical practices still regard male bodies as the standard, affecting diagnostics and treatment protocols. For instance, menstrual disorders like endometriosis are poorly understood, leading to inadequate management and significant health costs. Investing in proper diagnosis and treatment can not only alleviate suffering, but also reduce economic burdens on health systems. One of the key issues we need to address is nutrition. Poor nutritional practices before, during, and after pregnancy lead to severe complications, including low birth weight, affecting nearly 20 million infants annually. These infants face a higher risk of infections, developmental delays, and chronic diseases. On the flip side, issues like overweight and obesity present significant health risks for women, increasing susceptibility to non-communicable diseases such as diabetes and hypertension. While effective interventions exist, investment and innovation are vital to reach women and meet their unique nutritional needs. As we commemorate ICPD's 30 years, we acknowledge the strides made in reproductive health and rights. The use of modern contraceptives has increased significantly. However, progress in reducing maternal mortality has stagnated in 131 countries. This reflects a broader issue. While we may have made investments, a holistic response is still needed to address sexual and reproductive health across the life course. Ensuring women's health translates to unlocking a significant untapped resource for the world. Thank you all for your commitment to addressing the unique needs of women at every stage of their lives, ensuring they have agency, autonomy, and opportunities to thrive. I thank you. Vielen Dank.
Thank you so much, Dr. Tedros. Before I introduce our next speaker, I just wanted to say, listening to all of the speakers, I'm sure, like you who work on these issues all the time, and like me who reports on them every day, you're familiar with everything that you've heard, but it is so crucial that we are reminded of these statistics because they need to drive action. Dr. Khanum, I was struck by the question you asked, which was why? And we have to keep asking ourselves, why do we accept such galling inequalities, such stark differences, and what are we going to do about them? And so it is really wonderful to hear of the leadership from this stage. So from leadership in government and multilateral agencies, we pivot to youth leadership and a first-hand account of how one young woman's life can change what she's able to do as she's able to exercise her rights and make her own choices. Please, again, welcome up to the lectern, youth activist and innovator from Tanzania, Gloria Charles. Karibuni.
Ladies and gentlemen, Your Excellencies, I stand before you today as a proud Tanzanian girl who grew up amongst the Maasai community. In my village, the rites of passage for girls were predetermined long before we could even dream of what our future might hold. Many of my friends became mothers while they were still children themselves, never given the chance to explore the world beyond the narrow roles assigned to them. Their dreams were silenced, replaced by burdens of adulthood that they were never prepared to carry. Harmful practices like child marriage and female genital mutilation stripped away their choices and their future. But my story turned out different. My parents gave me the privilege of understanding my sexual and reproductive health and rights. I was one of the fortunate few who had access to SRHR education and services, which was not just lessons to me, it was a lifeline and a life rope. It allowed me to understand my body, my rights, and the power I had over my future. While my friends were thrust into motherhood, I was given opportunity to learn, to grow, and to aspire. That education became the foundation upon which I built my dreams, eventually leading me to become a public health specialist and an innovator. My journey has shown me firsthand the transformative power of SRHR knowledge and services. For me, access to these services meant more than just preventing early pregnancies. It gave me the tool I needed to make informed decisions about my body, to say no when I wasn't ready, and to say yes to the opportunities that changed my life. When girls are empowered to take control of their reproductive health, they are also empowered to pursue their education, build career, and become the women they have potential to be. Yet, for so many girls in communities like mine, these services are still out of reach. They remain tied down by cultural norms that deny them the rights to make choices about their own bodies. This is not just a violation of human rights. It is the loss for our communities and our nations. Every girl who is denied sexual and reproductive health and rights is a dream deferred and a future cut short. Through my involvement with Afyatun, an innovation we developed through UNFPA Hack Labs, I have had a chance to create solutions that tackle harmful practices like child marriage and female genital mutilation. Afyatun uses storytelling to challenge these harmful practices and norms that engage communities in dialogues about the health of the girls. This is more than just a solution. It's a movement to end these practices and empower girls to make informed decisions about their lives. When we invest in SRHR services and education, we don't just change the life of a girl or increase the numbers and statistics. We create a ripple effect that transforms families, communities, and nations. Girls who can make informed choices grow into women who are healthier, more educated, and more empowered. We grow to become leaders, change makers, and innovators. We become, as I stand before you today, the embodiment of what is possible and what can happen when a girl is given the right to choose the path that she wants. We must challenge the norms that seek to control and limit girls' potential, and we must uphold our rights and honor our dreams. As I said, it's not about just one girl. It's about the ripple effect that we create in the communities and the embodiment of more girls who will turn out one day to be like me, to fill the rooms like this. When we empower girls with SRHR education, we enable their future to come into reality. Thank you.
Thank you, Glory. Thank you to you, our four speakers. From each of you, I, if no one else, has learned the value of leadership, the leadership that we need to see, whether it is moral, financial, at the community level. But I've also learned about the importance of story, and whether it was the example that Minister Schulze gave of the woman in Togo or the story that you have just shared, Glory, it is important that we remember that as human beings, it is to other people's stories that we connect, and it is stories that re-energize us to keep acting to close the gaps that remain in women's health. So in short, the ICPD program of action is not just about numbers, it is about people and their stories. So again, I would like to thank you all, starting from the end, Glory Charles, Dr. Tedros, Dr. Canham, and Minister Schulze. Thank you for joining me on stage. I would like to ask that one of you stays here with me. Unfortunately for you, it is you I have chosen. But thank you. A big round of applause to our speakers. Minister, you drew the short straw. So we are now about to have some discussion. Please, joining the minister, let me invite up our next three speakers, Honorable Minister Kumbinze Chiponda, Dr. Atul Gawande, and Victoria Gamba. Please welcome up to the stage. As they take... because they haven't changed the name tags, it doesn't really matter. As they're taking their seats, we will just have a quick change of name places so that we know who is speaking.
I can't be Dr. Tedros.
Or we can all live our wildest dreams of being Dr. Tedros for the morning. Thank you. Please, a big round of applause to the people who keep the show rolling with fresh water and name badges. Thank you so much. All right, so our first discussion session, I can start to set it up as names are being changed. We're about to have a short discussion entitled Leave No One Behind in Women's Health. The opening sessions have pretty much set out why that is important. So we have seen so much progress over the last 30 years. Access to contraception, as you have heard, has increased. Maternal mortality rates have decreased. And awareness of reproductive cancers is on the rise. However, again, in repeating what you have heard, that progress has been unequal, and not everybody enjoys equitable access. And multiple concurrent global crises have only exacerbated the challenges. So just to get to what our speakers are going to address, the health needs of women and girls requires investment, innovation, and collaboration. So let's talk about how it is we leave no one behind. I didn't introduce them in full. Dr. Schulze, Minister, I've already introduced you, so if you don't mind, I'll introduce our other speakers. Honorable Minister Chiponda is the Minister of Health from Malawi. Welcome. Dr. Atul Gawande is the Assistant Administrator at the United States Agency for International Development. And joining him, and we will of course hear from you a little bit later on in this segment, is Dr. Victoria Gamba, a gynecologist at the University of Nairobi in Kenya. Thank you. Please welcome them all again. So, first question. Germany actively promotes what you call, and we heard you talk about that, Minister Schulze, a feminist development policy. I was scribbling, wanting to know more. So what does that mean exactly for Germany? What does the Ministry of Economic Cooperation and Development do to improve the health of women and girls?
Yeah, thank you very much for that question. We just heard before about the inequalities in the world, and there is a threat to societies, and I think we have everything on board to do better and to enhance societies and bring them forwards. And this year, around 70 million girls will be born. And we need to change their lives. They need to have their own decision about their body, and they need to have the reproductive rights. We see what that means for every single girl. I found it very impressive what Gloria told us before. So that is what I do in my ministry. I want to make sure that people have access to sexual education, to contraceptives, to professional support during childbirth, to neonatal care. And we see that if we join our forces, we can be successful, we can make a difference in the world and bringing such things forward. For example, within the space of around 10 years, we supported more than 50,000 skilled health workers, and that makes a difference on the ground for the people there, and therefore it is important to continue with that. There are still areas, we heard that also before, where more work is needed, and progress on our most important health goals, such as lowering maternal and newborn mortality, that has been stagnating. We're on the right way, and now we stagnate, and every 7 seconds we lose a woman or a baby, and that is too much. We need to change that. And unsafe abortions are one of the main causes for a high rate of maternal mortality. And as a proud champion of the organization She Decides, I'm actively working to change that. And that means that we need to discuss about the things also where women and girls suffering in silence and suffering from diseases that even members of the health professions sometimes know nothing about. So diseases that have not been adequately researched or that are underfunded. And FGS, I don't want to speak that, in fully female genital schistosomiasis, FGS, that is a disease where WHO estimates that up to 56 million women and girls in Africa that they have FGS, and they get that from a parasitic worm, for example, as a result of washing clothes in rivers or lakes. And that means a lot of pain and infertility, complications during pregnancy, and a higher risk of getting HIV. And yet this disease is both. It is avoidable and is treatable. And it is therefore my pleasure to announce today, on behalf of the BMZ, the launch of a new initiative, From Neglect to Action, Invest in Women, Invest in Health. And it is aimed at fighting FGS. Launching these new initiatives, we are building on our long-standing engagement in regard to sexual and reproductive health and neglected tropical diseases. And the first partner is Malawi. And I'm really happy, Minister Chiponda, that you strongly committed in that, and that we're doing the work together to fight FGS. So that means a lot. I can announce it, and we just go on the ground and do it together. So thanks a lot for this partnership.
Thank you for that. It's wonderful to see what that policy is in practice. So, Minister Chiponda, a little name change is being done. You get to be Dr. Atul Gawande. Minister Chiponda, the minister has already sort of teed up the new collaboration on female genital schistosomiasis. So how does this fit into the other priorities in your ministry in Malawi regarding women's health?
Thank you so much. First, let me really express our sincere gratitude and thanks through the minister to the German government for the support which they have been giving to Malawi. And of course, this year we're celebrating 60 years of the relationship between our two governments. So for that, we are very, very grateful. I think the most important thing which I want us to know is that we will not attain SDGs if we are not attending to these issues, including the neglected tropical diseases, those affecting the women. All of us were talking about SDG 3, but good health and well-being means even that woman having access to treatment and care if they have FGS. So I'm happy that German government, through the minister, they've taken it upon themselves. Because some of these conditions, like FGS, I'm sure maybe 3/4 of those who are sitting in here, they're like, what is FGS? Is it a new thing? You know, they're asking somebody from WHO, they're Googling, what is FGS? It has been there for years, but nobody pays attention to it. And when we say our women, they've been suffering in silence, this is what it means. It can cause infertility. Can you imagine how many women they have gone up to the mountains to pray? They have gone to a herbalist. I'm not bearing, I cannot get pregnant. Not knowing that it is schisto, something is treatable. But because we don't have access to health services, we don't have enough qualified health workers as well. So, you know, when there's this opportunity, and thank you so much. So what is going to happen is that GIZ and in Malawi, we have formed a partnership to control FGS. And this partnership is going to run from 2024 to 2026. Basically, we are looking at integrating FGS in healthcare services in Malawi. That means from primary to secondary to tertiary. By the way, Malawi, 20% of Malawi is along Lake Malawi, which means bilharzia is more prevalent in those areas along the lake, and which puts women along those areas at high risk of getting schisto. So in this partnership, we'll be able to build capacity of the healthcare workers for prevention, detection, and treatment as well. But we're also going to raise awareness of the female genital schisto among the populations as well. But also we're going to empower affected communities, especially the women, to prevent the transmission of the schisto, but also to seek treatment earlier when they have expected of FGS, and also reduce the stigma of FGS. You know, anything which is genital, you know, there's a secret around it, which increases the risks to the women as well. But if we increase the awareness, community engagement, to say, you know, there is hope. When you have it, there's a treatment. It's nothing to be afraid of. It's nothing to be hide. You know, there is treatment, and that really is going to help. So really, let me once again express our gratitude to the German government for this rare opportunity which we can contain and also control FGS, but also with the integration of issues like cervical cancer. If you have a healthcare worker, they do cervical cancer. At the same time, they also do FGS. It will be a win-win situation for us. Thank you.
Thank you so much. I'll be watching with interest to see the results of that partnership, 2 years, and hopefully much more beyond that. Dr. Gawande, let me come to you next, please. How does USAID work to ensure more women and girls, especially those who are left behind and suffering from the most neglected conditions, as we just heard, female genital schistosomiasis, you have to get the words out first before you can invest in it, can access comprehensive health services and realize their right to sexual and reproductive health? Well,
let me start by saying there are multiple ways the U.S. government manages to make a difference in sexual rights and women's health. Number one is going to the theme of this whole program. We invest in women's health. And we are incredibly proud to be consistently the largest bilateral donor towards family planning assistance and sexual rights and reproductive health. We are committed to supporting the agenda, and we have been from the very start of the Biden-Harris administration. It's reflected in their last year's budget of $607 million in funding in the last fiscal year, where we're investing in family planning, global assistance, and SRHR. I want to take it a step further. I know everybody's thinking about the upcoming election, right?
The elephant in the room.
What I want to point out is that during the last decades, this has consistently been Republicans and Democrats supporting across the spectrum the work in this space. There are areas of conflict, no question, and many aspects of this agenda can be under threat at any moment. But over time, the United States has been there consistently, and I want to emphasize that. It makes a difference that there are many parts of the community across the world that are raising their voices to insist that this be a continued commitment around the world. The second part I want to emphasize here is that we're making a difference in the work we're doing by emphasizing that this is that the components of sexual and reproductive health services are basic components of primary health care, that these are they are a necessary part of universal health coverage services and advancement of health systems as a whole. And the work we're talking about with FGS brings it home. The U.S. is also the largest bilateral contributor to neglected tropical disease elimination, including schistosomiasis. Now, these two programs cannot exist apart. The FGS, to explain a little bit more, and Minister Chapanda expressed it beautifully, the difference it makes in women's lives. It is a chronic parasitic disease that affects the reproductive organs. It produces a pelvic and vaginal pain, can produce pelvic and vaginal discharge. Can look exactly like pelvic inflammatory disease from sexually transmitted diseases instead of like a parasite. And therefore, when women come in with these complaints in areas where schistosomiasis is common, which is in many countries in Africa, they are easily dismissed because there is one program over here for NTDs and there's another program over there for primary health care and family planning and sexual and reproductive health. That cannot go on, and this effort is to combine the services in primary health care and enable these programs to make a difference. It's 55 million women that are estimated in Africa alone to be afflicted with urogenital FGS. So that is the size of the neglected problem, as the minister pointed out, easily treatable with a single drug, praziquantel. We are doing mass distribution. The United States supports programs in 13 different countries in Africa to eliminate schistosomiasis. And so, and we're delivering over 30 million treatments a year in mass distribution, but it needs to also be diagnosed for the 55 million women who already have the disease, and it's reflected in our ability to have basic diagnostics and basic recognition that this is diagnosable and treatable. It's just one of many aspects of providing appropriate SRHR. Thank you.
Thank you. So the journalist in me really, really, really wishes we could dig into some of this further. I have so many more questions for you. Alas, we don't have time for that. And so it's just up to me to thank you again, Dr. Gawande, Minister Chiponda, and Minister Schulze for the words that you have shared with us to highlight some problems that are immensely treatable and afflict so many people, 55 million women just in Africa when talking about schistosomiasis. So the only thing that it remains for me to ask you, if you don't mind me coming back to each of you for a final remark, a final thought, is it is easy to feel despondent or cynical given the size of the challenges we have. We've heard already about polarization. We've heard about funding not going to where it needs to be. And so what is it that makes you hopeful? I mean, is there a reason to be hopeful? I hope so, because what you're about to say will be the steam under which these folks leave this room for the next 2 days. So do you have something that makes you hopeful, and what is it? Let me start with you, Dr. Gawande.
I'll start with Gloria Charles.
Yay! We will all say Gloria Charles.
The younger generation does not accept that there is a difference between your sexual and reproductive health and rights and basic health and rights. And they are making their voices loud and clear. The fact that we're bringing these services and these considerations to the community creates tension. And it's the young people and the young voices in those communities that make sure that the reasons behind this are heard. This is the opportunity for women and girls, and therefore all of us, to have freedom and autonomy over our bodies and our choices and our sexual lives. So this is crucial.
Minister Chiponda.
Thank you so much. So for me, really what gives me hope or what keeps me going amidst all the crises is exactly what is happening here. The German government hosting the World Health Summit and partnering with us. They did not say, no, the female genital cysto is not our problem. No, they said, no, if it is Malawi's problem, it is our problem. The CSOs who are here, our youth who are here, giving us the platform to network, to collaborate, to discuss. That is what gives me hope, that no, we are together in this. I'm not alone, no. I'm with my sister here, and I'm with my brother here, and I'm with my daughter there. And that gives me hope. Thank you.
Thank you.
Yeah, it gives me hope that we can make progress. We see that from the Cairo process from 1994 to today. We are able to organize progress when we join our forces. And that is what we are doing here on this conference. That is what we are doing here in this room, making this topic a topic on the main stage, talking about that with a lot of people and bringing it out of the silence that you mentioned before. So that gives me hope.
Thank you all. Thank you. I think, Victoria, that is a wonderful segue to you now, if I may. I'm also curious, though it's not part of the agenda, what gives you hope? So if you are addressing us, please also tell us that, because I think it's important to have radical hope, not a kind of, rose-tinted hope, but a hope that actually, if we persevere in something, we can actually change it. So please do share with us your perspective from Kenya, and then we can end this part of our session, please.
Good afternoon, good morning for those of us who are joining us online. My name is Victoria Jibhad, and I'm equally surprised that a lot of you know so much about FGS. Fast forward, or if we go back 5 years ago, 1 year, 1 month today, we sat in a conference hall just like this, and we were trying to figure out what is this FGS to start with, and what do we need to do to make it more mainstream? Because As we all know, FGS, the first case of FGS was known in 1899. Quick math, that's 125 years ago. Some of us are knowing it now, but don't worry, you're in the right place. We'll teach you about it. So as we summarize, I think I want to give it in two pieces so that to answer your question. The reason why we are here is just to try and make women's health integrated, because we all know, as Dr. Atul has said, all this presents like a similar PID, STI, and all those things. So what is our role in now this journey? And I think I don't want to speak too much into that so that I release you. Then I can come back to the next steps. So our why is to make all this accessible to the women and girls that we are serving. Thank you.
Thank you. No, please, sorry.
I can continue?
Yeah, please.
Ah, okay. Thank you. Back to my speech. So 24 years ago when I heard the word gynecologist for the first time, I wanted to be it mainly because the first thing, it sounded complicated and sophisticated. So I wanted to be that just mainly because of the name. But the second reason that brings hope back was because I also wanted to be the best friend to a woman. But that said, I didn't envision myself 17 years later sitting in front of a woman. And most of the time, they used to come with advanced cases of cervical cancer. They come with infertility, recurrent pregnancy losses, and they were mostly at their worst spaces. And at that point, even with my knowledge as a gynecologist, I mean, we do the hard stuff. I couldn't offer more, any other intervention. The best thing was, I'm sorry that this is going on, but there was really nothing much I could do. But as I went along, some of the 4 questions that kept me going through and revisiting this process, when you look at the different diseases, but the 4 questions that they kept asking was, what did I do wrong? How could I have prevented this? Can it be treated? And number 4 was, how can I make sure everyone in my family doesn't go through what I've gone through today? So when you hear those 4 questions, I don't know whether you're hearing these women trying to talk to you and asking you that same question in your same place where you are, because you can see that these women have been coming to the hospital, they've been coming to the various centers, but we are not giving them what they need, because as Atul had said, we are fixated on, I work in family planning, or I work in cervical cancer screening services, or I work in whichever spectrum that you're doing. So at that point, when that lady is in front of you, you're at least bothered to really tease out what they need. And I think coming together as a whole, we're trying to say this. FGS, as we've said, is a chronic disease caused by a parasite, and it presents non-specifically. And it can cause all these complications that we're talking about. What we're trying to do is build an integrated response of healthcare workers who can have that foresight to actually have that high index of suspicion to say, you probably could have FGS, and this is why. And I'll tell you how we started in Kenya. In Kenya, 5 years ago, we didn't have any prevalence or baseline levels of female genital schistosomiasis. But as we moved along, we just went with one thing. We knew that these areas are endemic for schistosomiasis, and if we went with the right skill, with the right knowledge, we'd be able to actually get these women and girls where they are. And as I would say now, we've gone to 3 different counties, we've gone to 9 facilities, we've gone through 4,600 women have been screened for FGS. And out of that, 660 have actually been positive for FGS. So we're changing lives no matter how small we are, but we're giving them hope, because when you listen to their stories, they actually come and tell you, I was at this point. I usually call it a relay race that we're in. They first of all come to the primary healthcare level at the community first before they actually leave the house. You have to ask for permission from the husband. And now you can imagine you have recurrent discharges, you're having pelvic pain. What goes around is you definitely have an STI. So how do you even ask your husband for permission to actually go for treatment for that? So before that, that's the first journey they have to go through. Then once they go to the primary healthcare level, without the knowledge, without the skills, you definitely can't diagnose FGS. So then they go back, they're treated for STI. The second time they come around, you're probably, if you are in my space, you'd probably say, probably that antibiotic didn't work, so this time we're going to go for an injection, the whole spectrum. Then they still come back again. Now you can imagine that face of that woman having to undergo all those different types of methods of treatment, and it's still not working. And then by the time they come to me in the referral facility, it's too late. They have advanced diseases, they have advanced cervical cancer, they've probably gotten the HIV. We say FGS increases their risk of HIV and AIDS up to 3 times. So it means we've really missed the mark. We've really missed the mark from the point go. And this woman was there with us the whole way. They kept coming, but we sent them away. So what are we trying to say in a nutshell? We can change this. I think you can see from the 4 questions that are posed that these women are actually asking, what can you do before all this comes? And that's when we don't normally do it in terms of investing in women's health. We are more into how do we treat? But these women are asking you, how can we prevent this from the start? And this is where now we can work, all of us together, because it's a development issue. I'm sure the number of times I've looked at the water bodies when we go to any of those hospitals, I can tell you with my medical knowledge, I really don't know how to make that water safe. But when we ask our development partners, you probably can help us to make it safe. So that said, we all have a role to play in this journey of ending FGS. And before I leave, I just want us to say female genital schistosomiasis in full, because I know I am a trainer, I am a teacher, but I know most times most people it's a tongue twister. So please, if I may ask, can we all say female genital schistosomiasis? Let's start. Female? I didn't hear that. The last part, I didn't quite hear it. Please, I didn't quite hear it quite well. Just say schistosomiasis.
Schistosomiasis.
Are we going to end it?
Yes.
Thank you.
Thank you again to our speakers. I bet you didn't expect when you came in here today you will be rehearsing the words schistosomiasis. When you see Dr. Gamba in the hallway, she will prod you, so please be practicing it if you remember. Thank you again to all of our speakers. You may please leave the stage. Please give them another round of applause. All right, wonderful. Okay. How are you all doing in the crowd? Oh, we've already lost you. Thank you. There's one person. How are you? You're fine? Good. You had a question. Unfortunately, we do not have a Q&A session. However, it is all an open plenary, as I understand it. So please do grab the person for whom you had a question. Who was your question for? Everyone in the, oh, then you will definitely be able to grab them. In fact, you're sitting the closest to Dr. Gamba, so I suggest she shimmies your way, and then you can ask her your question. But thank you. Please do, unfortunately, this session doesn't allow for Q&A, but please, I'm hoping that the opportunity of being here together is, as Minister Chiponda said, the opportunity to network and talk with each other and ask your questions. Yeah, the naughtier bits get done off the stage. Okay, so I'm about to introduce our next session, Accelerating the Global Health Agenda, Advancing Innovation, Research, and Investments in Women's Health. So far, we've heard a little bit about the global trends in women's health and about addressing the needs of the most marginalized women. Our next session will focus on actions and priorities to drive progress in women's health, reduce inequities, and accelerate research and innovation, as well as leveraging new partnerships on the path to sustainable development. So, I invite you to help me welcome Professor Dr. Heyo Kromer, who is the Chief Executive Officer of Charité. We heard a little bit about that before. Please do come up to the stage. Dr. Rufeng Joanne Cheng, Director of Women's Health Innovations at the Gates Foundation. Mr. Miles Kemple, Executive Director, Sexual and Reproductive Health and Rights at the Children Investment Fund Foundation. Welcome to you three. It's really fantastically coordinated because I've heard all your organizations mentioned in the previous sessions. Funny that, isn't it? So you will not be a surprise to anyone and the work that you do, so let's get straight to it. Can I ask you first, Dr. Kromer, a question? We heard Charité is partnering with the UNFPA for Women X, and that the first collective hub is about to open in Berlin. By the way, I love the name. Whoever came up with Women X is fantastic. How do researchers and health practitioners at Charité contribute to advancing women's health? And does your institution position itself, how does it position itself to strengthen collaboration between countries and communities? So basically tell us about your work.
That's right. First thing I'd like to say is that I'm really pleased that this issue has come up really in the public now. And if you look at that and think about how to further advance it, there are two issues. One issue is content and one issue is structure. And I would like to explain both real quick. So the topic, in terms of content, is a leading theme in the Center of Global Health department in the OBGY department at Charité. And together with the partners from the world, we endeavor to integrate the topic in the daily work and also in particular in the interaction with partnerships with other clinics throughout the world. So there are successful global clinical partnerships which we use, like Trans-African Digital Health Network and others dealing with oncology research and other things. So that's content. There's more to it, like pregnancy vaccination and other things run by our center. The thing I would like to emphasize is if you really want to position that long-term in the academic medicine, you need to have structures. And Charité is not always far foresighting. But in one case, our predecessors in 2003 decided to establish a full professorship in gender medicine, which basically was the first step to realize that. And today's Professor Stadler is really doing prevention interventions, innovative teaching, and has a focus on recruitment. So overall, it's a structure in the unit, and the other part of the structure, which you mentioned already, is the interaction with others. And I think there's a collaborative approach really essential. And like today at WHS, we put it in the public eye. And we are particularly happy at Charité about the arrival of the UNFPA at Berlin. It's a significant milestone for us, not only for us and the BIH, but also for networking and bridging. And I'm really pleased that we have the close partnership with you and that we are hosting, you liked already the name, the Women X Collective Berlin Hub at Charité, which will be open tomorrow. And there will be a public attendance to that, and you're all invited to look at that. There are three issues with that: adaptation of intervention, local health systems, assessment of needs of innovations, and scaling up evidence and innovative interventions. So we're really happy to have both the structures of content and teaching and on the other hand, tomorrow's opening of the center. Thank you.
Fantastic. Congratulations to you on that. Dr. Cheng, from academia and research to philanthropy, how can targeted investments help drive progress in addressing both basic needs and advanced health solutions, as we've been hearing about the great need for?
Thank you for that question, Eliza, and thank you to the organizers for inviting me to share my perspectives on this topic. Congratulations on UNFPA and the Women X Collective, and to the honorable ministers of Germany and Malawi for the collaboration on FGS. It's really wonderful to hear. I want to just start with a very simple thing, that women are not the same as men. This seems like an obvious and intuitive thing, but actually, even on the cellular level, every cell has a sex. And the X chromosome is actually which women have 2 of, is larger and has more genes on it than the Y chromosome. There's 9 times as many genes on the X chromosome than the Y chromosome. So there's absolutely a basis for differences in sex in terms of how diseases manifest. And so it should come as no surprise. We heard that women live longer than men, but actually spend 25% more of their lives in worse health than men. This is a problem. And by investing more to understand women's health, we can actually unlock $1 trillion in the global economy. That is not a small amount of money. For people who are newer to investing in women's health, they may wonder how to get started, where to put their investments. And so we co-hosted an initiative with the US NIH, Office of Women's Health Research, to create an opportunity map. And the goal of this map is to articulate 50 high return on investment opportunities in women's health R&D. This opportunity map was co-created with 250 global experts in women's health. And to just put down on paper, we didn't want to say what gaps there were, but what opportunities there are. I have to go back and see if FGS is on the list. It turns out the Gates Foundation is the 2nd largest funder of women's health R&D globally. We want more people to come in under the tent with us. We can't do it alone. This is really a collective effort. We do it because we know elevating a woman through better health elevates her child, it elevates her parents, it elevates her community. So it's really a multi-fold return on investment there. In terms of where is my team investing, we have 3 health initiative areas that we're really focused on. And then I'll talk a little bit more around how we're investing in those areas. The first one is around contraception. The second one is around sexually transmitted infections. And the third one is gynecology and menstrual health. So for contraception, we're looking at research and development because 40% of women in low and middle income countries, when they start using a modern contraceptive method, they actually stop after the first year. This tells us that their needs are not being met by existing methods, that more innovation is needed. But we're not stopping with just innovation on the product itself. We're actually looking at how to bring down the cost of products so that the cost is not a barrier to access. And then thirdly, we're looking at how to get products to women. We actually have a large investment with UNFPA Supplies Partnership. And with that one, we're looking at how can procurement practices be efficient and how to operationalize procurement practices in a way that enables more products to reach women and supply chain strengthening. So really looking at value in different ways. So the last point I just want to make before I close is we really clearly see the value in investing in women's health research and development, and I hope everyone in this room does too. We've heard some great stories, and it's really important to address this need for half the world's population.
Thank you. Wonderful. Miles, can I come to you next? Just, of course, it follows on perfectly that the Children Investment Fund Foundation is also making strategic investments. How can high-quality, equitable initiatives, let me ask that again, how can investments in high-quality, equitable initiatives and solutions help seize the opportunities?
Well, thanks, Eliza, and thank you also for inviting SIF to be on this panel. So we recognize it's vital for us to strengthen coordinated investment. We've got a track record across nutrition, child survival, NTDs, co-funding collaboration, things like Nest 360, the FGS Accelerator, don't need to explain that acronym now, and the New Beginnings Fund, which we think will be powerful ways to get innovations rolled out faster and hold systems to account. Of importance to SIF is to bring the same attention and urgency to family planning and safe abortion investment, where investment in product development, innovation, and getting these to scale is a fraction of what is spent on other health priorities. Yet, as already explained, the return on investment is incredibly high. We do have some good examples, though, of where coordinated action has delivered equitable access. Many will know that SIF champions self-managed care as potentially a gender transformative way to increase bodily autonomy, vital for our ICPD goals. And a good example is the work that's been done on contraceptive self-injection. This is a transformation, no longer having to come back every 3 months for your injection, but being able to take doses home, providing up to a year of protection. It's one of the most important innovations in family planning, increasing continuation, and can save health systems valuable resources. In 2024, more than 6 million, mainly young women, are using this for their family planning, of which almost a quarter will be self-injecting. And that's up from less than 1% in 2019. Now, over 55 countries are doing this, but countries that have made the greatest progress are those that have prioritized collaboration. Countries like Malawi, where self-injection is over 33%, and in my own country, the UK's NHS is using the lessons from the Malawi model to understand how to make that service more accessible. So we need to build. We need to build on these types of collaboration. We need to leverage our respective strengths. As a private foundation, we should be taking more risks. That's why we do increase our investments in R&D. To date, we have committed more than $40 million for clinical research on novel formulations, including for on-demand contraceptive access, weekly contraceptive pills, and excitingly, a dual prevention pill that would combine both HIV and pregnancy prevention. But this only works, these types of investment only works if governments and bilateral funders make sexual and reproductive health central to their investments in primary health and community health. Spending more matters, but investing in a way that avoids duplication matters more, which is why we support the Women's X Collective. UNFPA is a vital part of the SRHR ecosystem. Since 2021, we have committed more than $50 million to the UNFPA Supplies Partnership. The potential for UNFPA to harness its role as a leading funder of SRHR supplies, to be a leader on market shaping, accelerated introduction of innovations, and coordinated R&D is tremendously exciting. So it was the easiest decision we could take to match UNFPA's investment to get the Women X Collective off the ground. We're encouraging other funders to join, and we're excited to be on this journey with you.
Please keep the mic, Miles, because I would like to ask again in the same sort of format as before, a final question to each of you. There are multiple competing priorities, multiple areas in which, whether it is investment or time or leveraging policy, where we can spend our time and effort. But what one key action, I'm going to force you to pick just one. What one key action do each of you think could be the most transformative in accelerating women's health? What would your answer be?
Well, look, I mean, so super, because I thought it was one sentence answer. My sentence was, policy matters. Countries that are working to reduce access barriers to contraception, to safe abortion care, will save lives, and investment should follow those decisions.
Wonderful. Policy matters. Thank you. Please.
Yeah, so we already learned how to say female genital schistosomiasis, but my first point was actually two actions. One, let's normalize the conversation. Let's not talk about women's health in a stigmatized way, in hushed, secretive voices. Let's remove the stigma, bring it in the open. Women's health is health. Let's just openly address it. Women's health is health. Yeah.
And your second piece?
My second piece was we need to center the work around women. We need representation. We need the voices of women heard. We have great leadership here in Germany and in Malawi and other countries as well, but that needs to pull through into other areas. In academia, as an example, 18% of department chairs are women. What we see being taught in medical schools is 1 hour spent on menopause in 4 years of the curriculum. In research and development in pharma, globally 2% of R&D leaders are women, and we see 4% of pharma R&D budgets spent on women's health conditions. And when we look at publications, scientific journals, the chief editors-in-chief of those journals, 8% of them are women. So these are people who are making decisions about what is funded, what is published, what will be researched. We need women at the table, we need their voices to be heard, and we need the work to be centered around them.
Wonderful, thank you. Professor Kerma.
Well, that was a bit more than one sentence, and I would like... don't worry. I would like to take something out of this in a particular way. The entire discussion has a bit focused on reproductive medicine, meaning on early stages of women's life. And I would really advertise to shift the focus to the entire lifespan of women. Because if you think over an aging society like Germany, due to our faulty Y chromosome, we die earlier. So an old society will consist of a majority of women with specific problems of elderly. And I would really advertise that we look at the entire lifespan in what we do in the future.
That's fantastic. Thank you all. All right, speakers, as you leave the stage, I will remind our audience of the key points you made. Thank you so very much. So we heard that policy matters. We heard that we should bring women into the mainstream, that women's health is health. And we heard that we should think about the entire lifespan of a woman and not just at the earlier stages, especially in the years in which she is reproductive. So thank you for all of that. Those are really strong points that we take away with us. We are about to close. May I please welcome up to give a closing remark to you all, again, Dr. Natalia Kanem. Please do to close us out.
Thanks, Eliza. Very exciting. Well, today we've heard inspiring stories, leadership, resilience, and the transformation that can occur when we invest in women. And these stories leave us with a clear and undeniable message. Women's health is central to achieving a healthier, more equitable world for all. Behind every statistic, there's a real woman or girl with dreams. And our mission is to ensure that every woman, regardless of where she may be or her circumstances, will be able to access the healthcare she needs and exercise her rights and live her life free from fear, violence, and discrimination. For far too long, women's health has been neglected, underfunded, and relegated to the sidelines. And yet today, we see that horizon because we have the knowledge, the tools, the donor interest, and the collective potential, the collective political will to change this. So let us go forth and build a future where women's health is a priority, not an afterthought. Help to break down the systemic barriers that are preventing women from accessing quality care. Invest in research and innovation that will address women's specific needs, and let us all make sure that every woman will have the power to make informed decisions about her own body and her own life. As is said in Chad, woman is the thread, woman is the needle, she's the weaver of family and society. So let us invest in women. Let us invest in the health and prosperity of entire communities and nations. And as we leave this World Health Summit, I hope we're reinvigorated and recommitted to the cause of women's health and gender equality. That's how we will create that world of peace where every woman and girl will reach her full potential. Thank you so much.
Thank you. Dr. Cannon, please stay. I'm asking you to stay because I have been instructed to invite all the speakers back at the end for a picture. But before that happens, it remains my immense pleasure to give the closing thank yous, really, of this session. As a Cameroonian girl who was afforded quality education because my mother first worked at USAID and then at WHO, and I actually applied for a job at SIF, but then the spreadsheet test, I was just like, maybe I should do journalism instead. And having, I grew up in Southern Africa, and Malawi was one of the first trips we took on a road trip. So for me, I have peaked. All my career dreams have been realized in this session. I'm wearing my mom's WHO watch to top it all off. So it is an immense pleasure for me to have been the host of this session. I hope that your words really there at the end reminded your peers here in the room of the urgency of the moment and the real life-changing potential of action and investment. Excellencies, distinguished guests, we have come to the end of our keynote session. While I hope that you have been inspired and challenged, I hope that you'll be taking some of what you have heard into the private meetings, the bilaterals, the coffee breaks, so that action can continue. Under this overarching theme of building trust for a healthier world, the World Health Summit has brought together stakeholders from all sectors and regions of the world to discuss the most pressing global health topics. As a personal challenge to you, I would like to invite you next time to include the media as part of that. We have no trust without, so don't just invite us to cover your events. Think about how we can be partners in telling the stories of women and girls and other key populations. So I look forward to reporting on what you are achieving here today, maybe even to hold some of your feet to the fire for some accountability journalism. But yeah, for now, it has been my immense pleasure. And so thank you all again. Enjoy your summit. Please, speakers, do come back up for a final photograph. Please welcome them back onto the stage as we close. Thank you all. Thank you so much. What a pleasure. Thank you.